Well, with the Masseter muscle, we did talk about muscle hypertrophy. We used a famous person to discuss that. Look at, again, not muscle hypertrophy here. I'm lucky to be sitting and standing. We sit too much anyway, don't we? But we need to talk about something, and steroid abuse is it. Now, we do need, again, steroids in our body, and again, there's a discussion about steroid hormones, again, produced by the adrenal cortex, and medications, and if you don't have that, or this or that. So this is a separate discussion with the corticosteroids, separate discussion. Again, adequate amounts, again, is required for normal growth, development, sexual development, and functioning. Again, we talked about the corticosteroids. Again, anemia that does not respond to normal therapies to combat some type of body wasting in such disorders as AIDS. Anabolic steroids cause an increase in skeletal muscle growth and a decrease in body fat. And that's kind of what the steroid abusers want. They desire that latter effect. And as we know, it went through, again, baseball. There was some discussion, I guess, in wrestling, but I don't know if that went anywhere. Again, weightlifters were the first to start using anabolic steroids to stack the deck in their favor during competitions. But participants in all types of sports are abusing anabolic steroids at this point. Even middle school and high school students are abusing these drugs. In a 2016 study monitoring the future, middle and high school students in the United States were surveyed, and 0.9% of 8th graders, 1.3% of 10th graders, 1.6% of 12th graders were found to have taken anabolic steroids at least once. And that was in Johnson et al., again, 2016 study monitoring the future. This number has been decreasing again since 2001, so that's a positive thing. There are no data on anabolic steroid use in adults, but suspected that hundreds of thousands of individuals 18 and over are abusing. Males are, again, by studies, more likely to abuse the steroids than females. Again, that's an NIDA, again, information 2016. Anabolic steroids have a number of adverse effects that we're going to see in both sexes. We need to have this information, again, go to our student base. That includes heart disease, high blood pressure or hypertension, stroke, myocardial infarction, cholesterol changes. They have a high LDL and a low HDL, again, for your nutrition geeks. Liver tumors and cancer, depression, eating disorders, increased risk of blood-borne diseases related to injectable steroids. I mean, because it is, again, pathology, blood-borne pathogens. Non-sterile technique, trust me, and they share, and fluid retention, severe acne, and cysts on their face also. Now, also males have shrinking testicles, reduced sperm count, baldness, breast development, increased risk for prostate cancer. Then you got to kind of wonder, remember, we do have an uptick, again, in prostate cancer right now. Females, growth of facial hair, male pattern baldness, amenorrhea, remember that's difficulty, you lose, again, your menses, deepened voice, enlargement of the clitoris. Teenagers take anabolic steroids before they have completed going risk, never attain their height potential. Some of these effects are reversible, but the longer the abuse occurs, again, the more likely they become permanent. Now, again, there have been studies that show aggressive behavior, property crimes, again, theft and vandalism among steroid abusers. Now, I think maybe that's pushing it a little bit, but again, in that state, they do feel good to each other, but then there's thoughts of, again, while on the drug, depression, thoughts of suicide, violent mood swings, again, when the drug is stopped. So, if they report the use, or you kind of notice and that type of thing, all of us as dental professionals, just like any kind of other abuse, we need to be made aware of this. So again, this might be a time, again, pharmacology might be covering this, but spend a moment and discuss that when we talk about the hypertrophy, again, of the masseter. Aware of the effects, prepared to discuss their use when indicated. Above all, the dental professional should be cognizant of the cardiac problems. That's what steroid, that goes beyond it. And then prepared to use treatment modification strategies to prevent then emerging situations in patients who have this. So again, signing off. Again, muscle hypertrophy, we have the information. Let's go ahead and share it. Bye-bye.